Hi, my name is Tanisha Cajas and I'm gonna talk about Selumetinib in children with Inoperable Plexiform Neurofibromas. Definition: Neurofibromatosis type 1 is an autosomal dominant genetic disorder characterized by multiple progressive tumor and non-tumor manifestations, has limited treatment options. Plexiform neurofibromas are histologically benign peripheral-nerve sheath tumors that occur in up to 50% of people with neurofibromatosis type 15-6 and can cause substantial complications.
Hello, in this health sketch we want to talk to you about neurofibromatosis. It's a bit hard to say, but the name makes sense. Neuro means the nerves in the body, while fibromas are the lumps that occur with the condition. There are different types of neurofibromatosis, and in this video we'll be talking about the most common type, NF1, which approximately 1 in every 2,700 people are born with. It is caused by a change in your genes, which is either inherited from a parent or a new random change in the cells that create a baby. This genetic change causes lumps to grow on the nerves. A number of different criteria are used to help diagnose NF1, and genetic testing may also be used. The most noticeable signs appear on the skin, which might be present at birth or may develop in early childhood. Flat, light brown patches on the skin, called café au lait spots or CALs because they are a similar color to milky coffee. They're often dismissed as just birthmarks. Freckles in unusual places, such as the armpits or groins. Lumps or bumps, either on or under the skin, which vary in size and number. Small lumps called cutaneous neurofibromas are generally harmless, and there may be few or many. Large lumps called plexiform neurofibromas tend to be few in number and are more likely to cause problems. Doctors can advise if removal or medication is possible. It's important to know that NF1 affects everyone differently. While some will have only mild symptoms, NF1 varies so much that others may have serious complications and additional related conditions. These might include learning difficulties, autism or ADHD, which will probably require more support in school. Problems with the joints and the bones, such as hypermobility, fractures, curving of the legs or spine, and changes to the shape of the chest wall. Problems with eyesight, if the nerve to the eye is affected. High blood pressure, which can be a sign of other complications. Epilepsy and other symptoms that relate to the nervous system. Disfigurement, which may or may not cause anxiety and impact on quality of life. In some cases, tumors such as brain and breast cancer. Because of this risk of complications, and because NF1 can change over time, it is important to report new or changing symptoms to your doctor so that problems can be picked up early. You should also have a routine checkup at least every year with someone who knows about the condition. Further tests may be required, such as an imaging test, and there may be treatments for specific problems, such as surgery. Depending on the symptoms experienced, a team of professionals might be involved in care, such as a pediatrician, geneticist, neurologist, dermatologist, eye specialist, bone specialist, oncologist, psychologist, and others. It is common to sometimes feel worried or upset about having NF1 or having a child with NF1, and you should discuss these feelings with your doctor. Online support groups are a good source of support, as you can connect to others who have had similar experiences. While there is no cure for NF1, and in some cases it can lead to serious complications and reduced life expectancy, with regular checkups and appropriate care, many people with NF1 can lead fulfilling lives. In this health sketch, we've talked about neurofibromatosis type 1, a genetic condition that causes lumps to grow in the nerves. We've talked about why it occurs, the main signs, the more serious problems to be aware of, and how it is managed. We hope this health sketch has been helpful to you and those around you. Health sketch. Health for all to see.
Applications in medicine. Selumetinib can encode tumors in children and young adults with a genetic syndrome called Neurofibromatosis type 1 and could improve symptoms such as pain and reduced mobility that are the consequences of the syndrome. Half of all these patients have plexiform neurofibromas which form in nerve cells. While most of these tumors are not cancerous, they generally grow on the skin or just below the skin.
The first good news was that we actually saw tumor shrinkage in almost every tumor that every patient that we enrolled. And this shrinkage was not dramatic and large in most patients, but it was measurable. And this is something we had never seen before. And what is important here is that we treat young patients, and most of these patients have tumors that are growing. And so even if we see shrinkage that is minor, what that implies is that we don't see growth. And in my mind, stopping a tumor from growing in and of itself could be benefit because we prevent complications that may happen. Our phase 1 clinical trial of the MEK inhibitor had the primary goal to really identify what is the maximum tolerated dose that we can give to these children who will have to take this drug for a long period of time. What are the side effects that we see? And in addition, how does the patient handle the drug? We call this pharmacokinetics, where we look at the plasma concentrations over time. In addition, as a secondary objective, we also wanted to look at what does the drug do to the tumors of these patients. Patients with NF1 have sometimes very large, disfiguring, painful tumors called Plexiform Neurofibromas, and we measure these tumors with a method using volumetric MRI analysis. Of importance is in many clinical trials that I've done in the past, we have not seen shrinkage of the tumors, and we have not seen that the medicines that we tested would delay the time to progression. So overall, most of these studies were negative. And my expectation going into this phase 1 trial with the MEK inhibitor was, of course, we always hopeful that something else might happen, but we didn't really, to be perfectly honest, expect it. We have studied these tumors at the NCI for a long period of time. We've developed criteria how to measure these tumors. We can sensitively measure changes over time, and we were able to implement meaningful clinical trial designs. This all kind of led up to us being able to really understand what is going on when we give new agents, and shows a prime example why the NCI is doing these studies. I do feel we have made substantial contributions here that would be really difficult to do outside of the NCI intramural program.
Pros and cons. Pros. Selumetinib, which is given in pill form, blocks a protein called MEK that is part of the RASL signaling pathway, making the drug shrink large tumors. Also, children feel better, have less pain, more physical strength, and better range of motion. Cons. Selumetinib has controllable side effects such as nausea, vomiting, diarrhea, and skin rashes.
When June was about 6 months old, we started noticing when she would eat that she had some swelling and redness on her cheek, and brought it to our pediatrician's attention. And our pediatrician had actually noticed beforehand Jane had some cafe au lait spots. At that time, kind of had an idea that it might be NF. And it was later that she had her first MRI and noticed the extent of the tumor. We're in Connecticut, and we went up to Boston. After about a year and a half, they noticed it was kind of growing at an accelerated rate, and that's when they referred us down to NIH. There's a lot of testing. Like every time we go,
Yeah.
Jane has blood work and MRI, and we have to write everything down. Like,
Yes.
I would always be the one who would make sure to wake her up, make sure to write it down. But now that she's older, she gets up, she announces, "I'm taking my medicine," and writes down her, keeps the log herself.
I would look at the clock, see what time it is, like see if I feel like getting up and going to take my medicine. If I do, go take it, and then go back to sleep. The first medicine only stopped my tumor from growing for a few months. The second didn't work at all, but then I got to try MEC. My tumor has shrunk 33%.
I pulled up an old video of her at Halloween.
My voice has gotten deeper so much.
Like it was remarkable looking at her.
When I knew what it was, I just said it's a tumor.
Remarkable to me to look at her face and see. I thought that your cheek had shrunk in the picture. I thought, or compared to now. She may have NF, but NF doesn't have her.
Come
Right?
on, you know you can't go.
Okay.
Neurofibromatosis is a genetic condition that affects 3 million worldwide. It causes tumors to grow anywhere in the body, even in between bones. And mine is on my neck, and so I have to have an MRI about twice a year.
Removing the tumor would involve essentially just cutting the veins.
And that would involve potentially losing the ability to swallow because it involves the nerves in the back of the throat and his tongue. Part of his shoulder movement because it involves nerves kind of across the back of his neck. His facial nerve, his beautiful smile. He would be hoarse the rest of his life, if he would even have a voice.
After 4 years of wait and see, and we're not sure, and there might be something down the pike, and let's just see, there's just never been anything salient to kind of hang our hope on until now.
Hello, Team Moss. Thank you for your prayers. My tumor has shrunk a total of 36%. Thank you.
Issue apply in Ecuador. This pathology is defined by the Ministry of Public Health of Ecuador within rare or orphan diseases, but there are no morbidity statistics in the country. What is known is that in Vaca Ortiz Hospital in the city of Quito, 7% of newborns are born with a genetic problem. Conclusion. Finally, we conclude that most of the children with neurofibromatosis type 1 and inoperable plexiform neurofibromas has a lasting tumor shrinkage and clinical benefit of selumetinib, demonstrating a significant increase in the child's strength and mobility as well as emotionally and on social scales.
Well, just the name NF, it should be common to people say it. Like if you say NF, everyone always says, what does that mean? And then you have to say neurofibromatosis. And they're like, well, what is that? And then you have to explain what it is. Bernadette is about 19 months old. She got diagnosed with NF1 at 4 months old. It's still scary not knowing what exactly will be affected with her.
It's actually really hard, not knowing what could happen, all the different types of things. It ranges how it affects everyone. Like Danielle has NF1 as well.
I have a very, very mild case. Now, my family is a little unique because it runs in my family line. My mom has it, my grandmother had it, my older brother has it, his son has it. And it has affected every single one of us differently. Growing up with NF1, I was teased a lot. Why do you have those spots? Why do you look different? And I don't want that to happen to her, having an adult point something out and be like, hey, come over here to their child, and then keep their child away from playing with her because they think that she has something that's contagious when she doesn't. I also had a lot of doctors that didn't know what it was, kind of unsettling going to a doctor and they don't know what you have and how it can affect you. That was a lot of talk back and forth as to whether or not we wanted to adopt or have our own, but at least I know for me, having my own, if they ended up with NF, at least I would have the knowledge so I could be a better advocate for them with the doctors and getting them the treatment that they needed.
With NF1, everybody's different. You're never going to know what's going to happen, when it's going to happen, and it's kind of like playing blind chess.
So my concerns for Bernadette are that as she goes up, she could develop different types of tumors and that they might not be treatable. And I worry that if she develops that type of tumor, she won't be able to grow up and get married and have a happy, healthy life.
Kind of watching and waiting is all you really can do. It's actually very nerve-wracking.
I want to make sure that she can go through school without feeling self-conscious about how she looks and how she walks. So my hopes are that people learn about it so she can have a normal childhood.
Thanks for watching.